Hi, everybody. Welcome to my channel. This is Dr. Mikhail Kogan, GW, Center for Integrative Medicine, Medical Director, Associate Professor of Medicine, George Washington University. So with this video, I open a new series that I'm going to try to do at least twice a month, maybe even more frequent, depending on how things roll forward. I'm going to start showing you different cases and how we treat them. They're going to be either a published case or just a very interesting case from our practice. Of course, all the cases will not have personal names or identifiers, except just for general information. Now, these are real patients. If they are presented, it means that we have obtained their consent to present the case without any identifiers. And of course, that these cases are going to not necessarily represent the general practice. They're going to be usually some kind of exceptional stories, but nonetheless, those are the stories that I think that do matter, and they do say, or they highlight particular aspect of several things. So one is definitely the missed opportunity for a lot of practitioners out there, in the standard practice especially. They also represent some kind of a unique, interesting outcome that was achieved by doing the work we've done, and also highlighting a particular topic that is not only not well represented or understood, but also is controversial to some degree. So, and we're going to start with a case from 2020. I'm going to go ahead and share my screen. This is a published case. It was published in 2020 in a complementary therapy in medicine. And it was, I directed the case, and then we had one of our students from University of Utah, actually, who was doing internship with us, Madeline Foley. Ilana Seidel, who's now in California, Justin Sevier, who's just graduated GW Medical School and going into psychiatry, and Julie Wendt, who at that time was a nutritionist with CIM, and we still collaborate a lot, and Julie works on her own now. So this is the story of an older man. He presented to us at the age of late 80s. Actually, I first saw him at university when he was, I believe, 89, and then he came a little later in his early 90s to GW-CIM. So the patient presented with a typical Alzheimer's disease-like progressive cognitive decline. For several years. At the time of presentation, he was rapidly deteriorating cognitively and functionally. And the thinking was that, you know, it's going to progress as any kind of other cases of Alzheimer's disease going to progress, and that the family should be prepared for the obvious outcome. So the patient's wife brought the patient to me and told me a couple of interesting points. He was a very cognitively engaged gentleman, senior. He was a senior leader at the CIA, with many people working under him at his prime in his 40s and 50s. He was undercover in parts of the in Afghanistan, and then at some point he was in North Korea. So he had a very decorated war and undercover or you know, the Secret Service agent for a long time. Very physically fit, very strong, cognitively very engaged. He spoke multiple languages, and he was eating reasonably well. So when we did a full intake, we realized that for several years, actually for like a decade, he was frequently eating swordfish, which of course brought us immediately to the question, could the mercury be part of this story here? By the way, this predates the recode. This case, we've physically seen in a 2010s, like, so it's about more than, or roughly 10 years ago. So this is before we started getting into the recode and Dr. Bredeson's work. Of course, now things are a lot more standardized, but back then they were not. So on the screen of the mercury, what you can see here, his methyl mercury. So let me walk you quickly through. This is a quicksilver tritest, which is one of the main tests we use in the clinic, although we still do use provocation tests periodically. Especially in combination with a tritest when we have certain specific treatment questions rather than diagnostic questions. But for diagnostics, we usually use tritest. So methyl mercury was very elevated. So was inorganic, and this makes a lot of sense. He had several silver fillings, actually more than several. He also was eating swordfish, And you can see that the total mercury was extremely high. Just to give you a contrast, we tried to bring everybody definitely under 1, ideally 0.5. And on presentation, as you can see, right, the total number of here was 7.5. So it's at least 15-fold elevation, if not more, from the goal. So, we started immediately treating him. We had him stop, of course, eating all the concerning seafood for a while, and we gave him some treatment to decrease the mercury. And then, he responded very well. I'm not going to go through the old details of treatment, but I just want to show you here. This was kind of a typical course. It's a complex binders, complex support of methylation, support for the liver, et cetera, et cetera. Now we use more of a quicksilver products and, not necessarily kind of a older, more complex binders. But of course, each practice do what they do, and there's a variety of different ways to do the mercury detox. So I'm not going to specify. By the way, this is such an old case that we were not using MOCA back then. This was more than 10 years ago. So we were using mini mental status exam, which is kind of obsolete at this point. But he presented originally was 20 MOCA, MMSC, which is kind of equal to MOCA, 22, 23 out of 30. And all other things were basically ruled out. His sugar was fine. His hormones, back then we didn't actually assess, but also he's 91, so it's a little less, it's a much more complicated whether or not how far you go into assessing hormones. And let's say you do find low testosterone, are you going to put 91-year-old on testosterone? Probably not. So, it's more complicated. And back then we were not doing that anyway. So what happened is after detox, you can see that he first dropped his total mercury, about 90-some%, and then later on even further, all the way to pretty much, I think, back at some point it was 0.279, which is, I think, at the goal. Notice he still had a little bit of inorganic, and interestingly, he only had fully decayed teeth removed. So he still had some mercury in his mouth, but he was pretty good detoxifier. Actually, if you kind of look here, you can see that for the inorganic mercury didn't detox. Actually, for both of them, he wasn't detoxing very well. This, you want to have this number, right? This dot above the middle line. That would mean he's a better than average detoxifier, but here he was not. And then the detoxification with basic treatment gotten somewhat better. And here, really, he was relatively low. And so it was really fascinating what happened with this story is that now this is not necessarily graphics are great, but what you can see, he started 2023, but he improved dramatically. He basically went from a mild Alzheimer's to a normal cognition. So he went from MMSE of 22 to 27. And then, he had several years of a decent, pretty good quality life. So, we got him here, and then until the end of 2014, and only sometime in the middle of 2015, we suddenly start seeing the rapid progression again. And this is when we discovered that he had multiple strokes. I actually had this case discussed with several of advanced practitioners after, and I think Joe Pizzarno mentioned at some point that, it's obvious that, this guy had strokes because you detox the mercury fast, and mercury is quite commonly can also increase risk of vascular disease. So the strokes would be almost expected in this scenario. So, but what I really want to point out, and here, by the way, we did mention the recode, because by the time we got this case published, that was already when we were doing recode. And again, recode information is coming soon when we analyze our data a little bit better. But those of you following my work already, I think we already presented a little bit of it at one of the Friday PM updates through the GW and AIM Health Institute. But what was interesting here, particularly when he improved in this roughly 12 months or so, following the treatment, he gotten so much better that he literally, his cognitive function improved so much that he was able to do more. And I think that's when he started getting really depressed, because he realized how different his life became, because he actually quite got altered in terms of functionality during the period before he started the treatment. He wasn't doing the finances, and he also was not interacting with as many people, and his control of things in life obviously was deteriorating. So when he started getting more awareness of that, I think that's when the depression set. And that's kind of this unique, challenging situation, as we're going to have more people recover from Alzheimer's disease. If they come in at the point where they're losing function and suddenly everything restores, they may not be able to be reintegrated into the existence of previous life. So you have to give people new meaning in life to make sure that they that they're not getting depressed and that they engaged. So that's the case. Thank you so much for watching. Again, I do suggest that if you have interest in particular cases you want to see, let us know. We may have such cases already, and I'm going to try to follow your suggestions and present cases that would be interesting for people. But otherwise, I will just be presenting typical cases in our practice. And I probably will have other practitioners come in as well and present. But I think in the beginning, first few months, it'll be mostly me. So thank you for watching. Thank you for continue supporting our work and a mission to bring health to public and to investigate non-standard approaches to medical care, and realizing that the standard care is often very limited and does not offer very good management of chronic medical conditions, because again, standard of care does not look into the root causes of problems, but treats the diagnosis with a standard allopathic approach. So I'm not discrediting that. We are a part of the standard system, but we just offer more services, and we are at gwcim.com. Hope to see you soon. Have a wonderful day. Take care. Bye.